By the end of this video, you will be able to define utilitarianism, utilitarian justice, egalitarianism, and egoism. By the end of this video, you will also be able to apply those four theories to cases in medical ethics. The first thing we're going to do is start with some history, and then we're going to talk about the coronavirus pandemic going on today. I will draw out some ethical questions about coronavirus, and then we're going to use those four theories as possible answers to the questions. We will end by applying the ethical theories to topics that come out of our discussion of coronavirus. So let's start with some history. In the year 1348, in Europe, there was the Black Plague. The plague started in rodents. Rodents came down with a disease that was contractable by the fleas that would bite them, and then the fleas that would bite humans would give that disease to humans. So people's symptoms were in mostly their lymph nodes. The lymphatic system would swell up, they would have blisters, so lymph nodes in your armpits and in your groins would have terrible aches. It was a terrible disease. There was no cure. Medical doctors quit their medical practice because the risk was just too high. There was a mortality rate of about 50% for much of the Black Plague. So we're talking some bad stuff going around. And other things going around were infected people. Infected people, if in groups in 300 people, 200 people sometimes, would go city to city begging for forgiveness for their sins so that they could be healed. We're talking the medieval period. So during the epidemic of the medieval period called the Black Plague, sick people were intentionally going around healthy people. Yes, that's right. We can think about why that seems wrong, and yet people are traveling right now, transatlantic flights. People are going right now to the mall just to walk around and get some exercise indoors during the cold or during the heat. People are going to work. People are going to school. People are going to the park. People are traveling during a pandemic. Is that right? In the last year, there has been over 100,400,000 cases of coronavirus. In this last year, globally, there has been over 2,600,000 deaths from coronavirus alone. That's a lot of sickness, pain, suffering. That's a lot of death from one disease. So, do we have a moral obligation not to travel, given that we're living in a pandemic? Would it be morally wrong for you to go to the mall to get new shoes that you definitely don't need because you have a pair of shoes already? Is it your moral responsibility to cancel your wedding now that there's a pandemic? Do you have a moral responsibility to stop playing sports because if you were to play sports, you would be contributing to the spread of an infectious disease that's killed more than 2 million people in 1 year? These are some ethical questions that I'm drawing out of coronavirus. Does the public have a moral responsibility to wear masks, assuming that mask works and assuming that the masks are being used properly so that they're getting their most efficient contribution possible? Do you have a moral responsibility to wear a mask, even if there were no state mandates? Talking about state mandates, should the government have the ability to require masks by law? And let's say that they have the ability. Should they? Notice that that's a different question. If you have the ability to do something, that doesn't mean you should. So here's a separate question. Should the government create laws requiring social distance? Like if you're caught closer than 6 feet with a stranger for no good reason, you both get a fine. Should that be a thing? That would slow down the spread of this very bad disease. So why not? Well, that would be focusing on the consequences. There's a theory for that. There is a theory called utilitarianism. And the theory of utilitarianism is that when you're judging whether something is right or wrong, good or bad, moral or immoral, ethical or unethical, you should just look at the consequences. And if it turns out that the consequences of the action is really good for the majority of people affected, then you should do that act. You should do whatever brings about the greatest possible good for the most amount of people involved, no matter what it takes. That's what it means to say the means justify the ends. The means, the method, how you got the consequences are totally justified no matter what you had to do, so long as the consequences really are really good for a lot of people, the most amount of people. So utilitarianism is an ethical normative theory that tells you what you should do or not do. And what you should do is whatever produces the greatest amount of good for the most amount of people involved, no matter what it takes. So we have this question. Should the government require face masks? A utilitarian's answer would be, does it leave the most amount of people affected the best off? Yeah, it would. Then the utilitarian says, yes, the government should require face masks, should require social distancing, should require vaccinations for anybody who is able to get one. Because the whole point of utilitarianism is to produce the greatest amount of good for the most amount of people. That's the value. There's a value on public health which trumps private liberty. A utilitarian will value public health, the common good, the greatest good for the most amount of people, and that value is way more important over any one single person's preferences. Your personal liberties or your private freedom doesn't matter at all when compared to the public good for a utilitarian. Let's look at a totally different normative theory. A different normative theory that has a different answer to that question is egoism. Egoism is all about your private liberty. It's all about your personal freedom. It's all about your preferences. It's all about you. You do you. You do whatever you want. You have the negative right not to be told by anybody else how to live your life. So egoism tells you to do whatever is good for you. You matter most. If anyone else matters at all, it's because you decided that they matter. You decided that they matter. That's why they matter. Otherwise, they don't. Only you matter. The ethical egoist values private liberty way more than they value public health. It's not that they don't. And it's not that the utilitarian doesn't value individuals' freedom. It's just that the egoist says your right to not wear a mask if you don't want to wear a mask is way more important than everybody else's health. And the utilitarian is on the other side. The utilitarian says public health and everybody's well-being matters way more than your personal preferences to not wear a mask. So when we have this question, should the government require face masks? There's different answers, and those different answers are justified by different ethical theories. Now, the ethical theories alone don't give you the right answer because you still have to choose. What side are you on? What theory do you subscribe to? What do you value most? Let's start over. So it turns out that when there's coronavirus spreading at an alarming rate all over the globe, some people's reaction is, yeah, but like tuberculosis kills over 1 million people every year and has for a lot of years. And the seasonal flu kills thousands of people every year and has for a lot of years. So what if coronavirus is killing thousands of people every year? Well, the relationship here between your perceived threat tells us a lot about what you are going to do in the face of being told, wash your hands, wear a face mask, get the vaccine, stay away from other people. Let me put that differently. Your perceived threat to yourself or your community, when it increases and you are more and more afraid something bad might happen to you, that implies you are more and more likely to do what the Center of Disease Control tells you to do. The less fear you have that something bad is actually potential, the less likely you will listen to the medical doctors or medical practitioners or the Center of Disease Control. So this is a fact, or imagine that it is, but there's been studies that show that an increased perceived threat implies increased compliance. You are less and less likely to wash your hands for 20 seconds with warm water and soap if you believe that that's not actually going to save you from getting coronavirus. Since we know this, doctors know this. They know that if you're not afraid to get sick or dying, you're less likely to do what they tell you to do. Should the medical doctors exaggerate? Should the authorities increase perceived threat in attempt to increase compliance? Would that be ethical? Would it be ethical for a medical researcher to skew their research and manipulate their data to manipulate the people into getting them to do what they think is the right thing? That's a tough question. Let's look at our theories for some answers. Well, if you are a utilitarian, you're all about the consequences for the most amount of people affected involved. The most amount of people involved. And if a doctor lying to people will get them to actually wash their hands and social distance and then slow the spread of an infectious disease, then that would be good. So the utilitarian would say, yes, authorities are allowed to and should increase artificially the threat or perceived threat so that they're more likely to comply with the recommendations. We have an answer to that question or a solution to the problem when we look at these ethical theories. The problem is nobody's washing their hands. What do we do? The solution, according to utilitarianism, is have the authorities lie to the people so that the people get afraid and think that they're really going to get really sick if they don't wash their hands, and that'll make them more likely to wash their hands. Let's start over. And this will be our last time, and then we'll end. There was an upper age limit on eligibility for life-saving ventilators in Italy from March to May 2020. That's a real example. So you've got 100 patients that come into the hospital. All of them need a ventilator or will die. You have 50 ventilators. How do you decide who gets a ventilator? In other words, how do you decide who lives? In other words, you're deciding who dies. How do you make that decision? In a pandemic, how should authorities distribute scarce resources? Here's another example. You've got 5 painkillers and you've got 6 people who need them. Who's that one person who has to live in pain? You've got 100 hospital beds, but 1,000 patients. Who gets a bed and who doesn't? You've got 5 people who need a nurse right now, and you've got 1 nurse. How do you use his time? The nurse is a hot commodity. That's a scarce resource. Who gets to be seen by a registered nurse during a pandemic? What's the right way to distribute the benefits of living in a society and having access to pain killers or nurses or ventilators or vaccines? Well, let's look at some theories. The utilitarian justice theory of distribution says you should do whatever leaves the most amount of people the best off. So that's the theory according to which Italy decided old people don't get a ventilator. Their thinking was something like this. Even if we save the elderly people's lives from dying from coronavirus, they're on their way out anyway. So let's not use our scarce resources on them. Let's let them die. Let's not give them life-saving treatment. Instead, let's use our resources that are scarce on the people who are going to have long lives. So let's discriminate according to age. And maybe that makes you feel outrage, but it's justified by the utilitarian justice theory of distribution. So maybe you're thinking, okay, there has to be another theory according to which things are distributed fairly. And that's true. There's a lot of different theories according to which you can distribute resources in general, but also during a pandemic. See, doctors might have a value of their patients. There might be something like a patient-centered care during normal times. But during a pandemic, there might be different standards. During a pandemic, a doctor might have the moral responsibility to allow their patient to die in order to use that resource on 5 other people. So we gotta wonder, are the standards of distribution different during a time of crisis? So if you are against the utilitarian theory of distribution, then maybe you like the egalitarian one. According to the egalitarian justice theory of distribution, you should do whatever makes people more equal. You should do whatever closes the gap between the most advantaged and the most disadvantaged. This would allow us to justify our answer if we said, young people are probably going to live anyway. The older people, those with underlying health conditions, are the least likely to survive. So let's give them everything we've got. Let's give them the nurses, the painkillers, the beds. Let's make them comfortable. Let's give them the ventilators. Let's take the most disadvantaged people and give them everything we've got so that they are closer in chance to surviving as those with a high chance of survival. That is justified according to the egalitarian justice theory of distribution. So, utilitarian justice theory of distribution, the egalitarian justice theory of distribution are 2 different ways to answer this and other questions. So far, what we have done is learn about utilitarianism and utilitarian justice, about egoism and hedonism, and egalitarianism. And we've taken these theories and we've applied them to cases in medical ethics.